Dr. Suzanne Kilmer, and I'm the Medical Director of the Laser and Skin Surgery Center of Northern California. And today, in honor of Father's Day coming up, I would like to talk about men's treatments, because there's lots of things that we can do for men. Some are similar to women, vessels on the face, we can laser, little bumps we can smooth out, pre-cancers, but there's also some things that we do similar treatments, but in different ways for men. So let's just start with probably the most common thing we do, which is a little bit of Botox. And you have frown lines right here, like the number 11s. Well, not only do I stop the 11s when I relax those muscles with Botox, it actually helps elevate the brows. And men, because they've had a lot of sun exposure, might have more sagging of the skin, and the upper eyelid skin can start resting on your eyelashes. I know someone I know very near and dear, that's the reason he does Botox, is because he wants to open things back up. You can also do the crow's feet and help with the smile creases. You can get the corners of your mouth because your children are upturned and we get sort of flattened, and then we get kind of downturned as we get older. And sometimes it's because we clench our teeth. But a little bit of Botox here and here will relax those and float the corners of the mouth up. And then probably one of our favorite things that we do with Botox is actually sharpen the jawline and make the neck look better. And what that is it's pretty much like a medical facelift, if you will. The platysmal muscles pull down the skin, and the face muscles we're trying to pull up. So we want the pulling up muscles to win. So we knock out the muscles along here, and the people that work out a lot specifically have built up neck muscles which pull this down. So by relaxing them, we really sharpen that jawline, which is a great look for men and women, because of course, who doesn't want their face to float up? And then speaking of jawline, for fillers, one of the things that we do quite nicely with fillers is actually sharpen the jawline. Because sometimes as we get older, we'll have some bone reabsorption and different things. And so we can actually, when we would place it differently for men versus women, which you can actually put some filler in there just to get that jawline nice and sharp. Or even chin enhancement. Some people are born with smaller chins, but some people, just as they age, their chins fall back a little bit. Again, you can use filler there. And then a lot of my men actually work out a lot. They're very fit, but as you get more fit, you lose fat in your face. We all know there's a trade-off. Either your face looks better or your body looks better. So for men, because they tend to have less body fat, putting filler in strategic places just sort of rounds that out a little bit. We're not going to feminize the face. We're just going to fill in where some of those shadows are. Just so that in photographs, some of the hollows, those areas, if we fill them in, it's just a smoother appearance. Again, not feminizing the face. What else can we do? Well, we have all kinds of tricks, but some of the more common things would be treating vessels, especially if you've had a lot of sun exposure. We have lasers that treat the vessels that can be around the nose, chin, cheeks. We can actually treat little bumps. Like as we get older, we tend to get sebaceous hyperplasia, seborrheic keratosis, big words that you may not know what they are, but sort of like the barnacles of life as we get older. We have all kinds of lasers to treat each of those individually. And then as men get older, as also for women, we thin out our hair. And there's some actual new improved techniques for improving hair growth, especially if it's related to aging. And in those cases, there's something called PRP, or platelet-rich plasma, where you draw the blood out, spin it down, and then you use that to stimulate growth in the scalp. So they're just some tiny injections that go in there. And it really documented studies showing how well that helps. In addition, there's some vitamins that you can take, and there's a hat, it's called a Theradome, and it's a hat that gives infrared light that helps to stimulate hair growth. And then there's more invasive procedures as well, but we'll stick to the simple, easy stuff here. And then sweating. I mean, again, men and women have issues with hyperhidrosis or sweating. And we have NeuroDry, which is a treatment that usually 2 treatments will take away nearly all of the excess sweating that people have. This would mainly be in the underarm area. A lot of men do that and love it. Let's see, what else? There's some hair growth. Some people don't like the hair on their back, on their back, or excess hair that we can treat with laser hair removal. Let me see, let me look at my little cheat sheet here. Tightening, we devices that help when you just want to tighten skin. It's not as easy for men to get a facelift because the scars are typically in areas that you can actually see them. So there's other ways to tighten the skin and again to smooth out the skin like we talked about before. And then it shouldn't be last but not least, it should be first and foremost good sunscreen so that you block the effects for the sun causing these changes. So definitely want to emphasize that that's important. And then there's topicals that you can put on that also are very helpful, like a retin-A or retinol type of topical, vitamin C. There's growth factors. My husband won't go anywhere without his TNS essential serum and his elastin creams. Those things, between those two, you get growth factors, vitamin C, pentapeptides, and then he also, in elastin production, and then also uses a retinol, which kind of covers the bases, wear your zinc oxide sunscreen, and do all that, and have a fabulous Father's Day. Happy Father's Day to all the dads out there. Thank you.